thank you everyone for giving up some time in your evening to come and join us to learn more about the clinical exercise physiology programs at ACU. My name is Christian Pitcher. I'm the head of discipline for clinical exercise physiology, and I'm joined by Sarah Hatton from faculty marketing at ACU and Dr. Jack Hickey, who's the course coordinator for the graduate certificate in exercise rehabilitation for sports injuries. If anyone here has a bit of an interest in that, we'll talk a little bit more about that later in this talk. Let's get started. We're all here to learn more about the Master of Clinical Exercise Physiology, our two different pathways, as well as our graduate certificate. I'm going to talk you through a number of things this evening, including things like how we deliver our programs versus maybe what might be delivered elsewhere. I'm also going to talk about our staff, our national teaching team. I'm going to talk about entry requirements later on as well, including how we deliver and organise our timetables. As is customary at ACU, in recognition of Aboriginal and Torres Strait Islander people's spiritual and cultural connection to country, and in continuing ACU's commitment to reconciliation, it's customary to acknowledge country as we pass through. Today, we acknowledge and pay our respects to the First Peoples, the traditional owners and custodians of the lands and waterways. We thank them for their continued custodianship. We acknowledge and celebrate the continuation of a living culture that has a unique role in this region. We acknowledge elders past and present and thank them for their wisdom and guidance as we walk in their footsteps. Now, I'm quite interested to know which part of country everyone here or our attendees come from. So maybe in the chat box, if you can, pop in, tell us where you're coming to us from. Are you coming to us from Melbourne, which is where Jack and I are based, maybe in Sydney, where Sarah's based, or potentially in Queensland, or maybe one of our other states? So let us know, use the chat function. We also have a Q&A function for this evening's presentation. And I will ask you, if you do have questions along the way, write them down. What I will try to do is reserve answering those questions to the very end of today's presentation. But if there are any that are pressing and aligned to some of the things I'm talking about, then I may answer them as we go through. So feel free to use the Q&A as well as using the chat box. Okay, so tell us, where are you from? Oh, my apologies. I've just been told chat might be disabled. Okay. Thanks for letting me know. All right. Let's continue. We'll see if we can't fix that. So many of you might be aware of exercise physiology as a wider discipline and as a profession here in Australia. I am an exercise physiologist, as is Jack Hickey. And we have our different specialties or the different pathologies that we work with and those that are indicated for exercise. And you can see here that there are a number of pathologies that exercise physiologists more commonly work with. And there might be some of these conditions that you have learnt about during your undergraduate studies or other had opportunities to maybe observe and work with some of these conditions through your professional practice. Exercise physiologists are employed across a number of different areas in the Australian healthcare system. As we've noted in that second table in the middle there we have exercise physiologists, graduates of ours, working in public and private hospital settings, within private multidisciplinary healthcare. Workplace health and rehabilitation is a big employer for our graduates, as is opportunities that are growing in residential aged care and retirement facilities. And it's an exciting space if you're particularly interested in working with geriatric populations. And you may know that we are funded by a number of different bodies, or our consumers, our clients, have access to us thanks to the likes of Medicare, the Department of Veteran Affairs, private health insurers, WorkCover, the National Disability Insurance Scheme, as well as the Traffic Accident Commission in places like Victoria. Just to give everyone here maybe a bit of a snapshot of the AEP workforce, we're a relatively young health discipline and a relatively young profession. You can see that the average age of exercise physiologists is for about 30 years. When we take another snapshot of our demographic of professionals, we also find out that most of our exercise physiologists work in metropolitan areas. Musculoskeletal rehabilitation is our #1 scope of practice, or it's certainly the one that's reported most by exercise physiologists. That's not to say that we don't work with a lot of clients who present with comorbidities. And the average wage for exercise physiologists is between $60,000 to $69,000 per year, which is equivalent to the other allied health professionals. So if you look at the same reports from occupational therapy and physiotherapy and the likes, our average wages are the same. Specifically at ACU, we deliver the Master of Clinical Exercise Physiology. We have two pathways, Pathway A and Pathway B. Pathway B was introduced to a cohort this year, which is our thesis stream. So if anyone here is maybe considering pursuing honours and wanting to do research, well, actually we've created a pathway, purposefully created this pathway for students like you to be able to learn and develop your clinical skills and then be able to put those into practice in a research environment. And Jack Hickey is one of our supervisors for a research student this year, as am I. And we're quite excited to be able to offer students a pathway to high degree research, our high academic achievers. We also offer the graduate certificate in exercise rehabilitation for sports injuries, and I'll show you how that's a pathway into our Master of Clinical Exercise Physiology if you choose to go that way. Our Master of Clinical Exercise Physiology is accredited by Exercise and Sport Science Australia, and we're also accredited by the State Insurance Regulatory Authority in New South Wales, and that is to ensure that our students, or our graduates, can work and gain access to clients funded via CIRA. Here are some highlights of the Master of Clinical Exercise Physiology at ACU. Firstly, we offer at Brisbane, Strathfield, Sydney and our Melbourne campuses. We use a multi-mode delivery, which means that learning occurs both on campus and online. I think most of you have had the opportunity probably to be learning online over the last couple of years. Well, I can rest assured, and I'll show you a snippet of our timetable, which shows that students are both separated between online and on-campus learning. We're focused on practice-based learning and professional skills, and we know that they're so important to ensuring that you're going to succeed in your clinical placement and then in employment beyond that. Our students do a minimum of 360 hours of high quality work integrated learning. We do pride ourselves on our work integrated learning program, and we have a very wide network of placement providers. All students in our program learn in ACU Exercise Lifestyle Clinic. So if you are an ACU student and you've been doing exercise science, maybe you've had the opportunity to do some placement internally within our clinics, all of our postgraduate students will do placement of some kind in our clinics over the course of their degree. Unlike a lot of other postgraduate programs in exercise physiology, ours has an option to both individualise and extend your scope of practice, and that includes research. And I'll show you what that looks like in a little bit. We have a very strong track record of employable work-ready graduates, and I can talk to many of our graduates who finished in the middle of this year. Many were offered positions before they actually were course complete, and we do pride ourselves on that. Here is an example of our full-time coursework pathway. So it's a 1.5-year program conducted full-time, and you can see there in semester 1, if we work from left to right, we have a number of units, or what we would call our foundational units of study. In musculoskeletal rehabilitation, we have units in cardiopulmonary and neurological rehabilitation, and really one of our, what we would consider one of our most important units, lifestyle and exercise counselling, which ensures that you know how to work with your consumers, your clients, and ensure the best client outcomes. In semester 2, we build on that. We have a couple of sort of translational units, and responsible clinical practice will have you working with your peers to host a pop-up clinic. Our students have just finished the pop-up clinic for 2022. And it's really exciting to watch our students put into practice what they're learning, what they've learnt from their semester 1 units as well as their semester 2 units with real clients that are organised for you. You can see in our second year of the program, we offer an elective unit, and I'm going to show you what some of those electives could be, as well as the clinical experience unit. So our clinical placement, external clinical placement blocks are organised in our second year of the program to make sure that you are both familiar with all of the foundational learning, and then that you can then put that into practice externally, knowing that there's nothing better than a clinical placement to showcase your skills, knowledge, and understanding to potential employers. As I said, you get an opportunity to choose an elective and really extend your scope of practice, but distinguish your scope of practice from some of your peers. And that is quite rare for a postgraduate program in clinical exercise physiology. We have a number of different themes. You can see here we have themes in high performance sport. You can pick our units from exercise rehabilitation for sports injuries, mental health, as well as research. And we see our students pick from these different themes. Now, potentially, there may be some additional electives for you to be able to choose from when you're choosing your electives to study in 2024, if you're commencing in semester 1 with us next year and studying full time. But you can see here that there is still quite a lot of options for you. In terms of our thesis stream, I'll just show you how it differs from our coursework stream from semester 2 onwards. Semester 2 of year 1 is the same, but then in year 2, you can see there that learning is extended by 6 months. So our placements are slightly different. You'll do placement with your peers in professional term 1 before semester 1 starts, but then you get stuck into research training and have an opportunity to work on the first part of your project if you go down that path. There's then a placement over winter and then another in semester 2 whilst you continue working on your project before it's completed in early November. I'll just note the eligibility for this pathway. So in order to study or to transition into pathway B, you must complete 8 units of the first 8 units of the MCEP. And you must have a GPA greater than or equal to 5.5. As well as that, your area of study needs to align with the demonstrated capacity for research and supervision within the school. So if you're particularly interested in working with musculoskeletal conditions, we have a number of researchers who are very strong in that particular area. Similarly, if you're interested in exercise oncology or working with neurological clients and want to do a project in that area, then you have an opportunity to talk to some of our potential supervisors towards the end of your first year. Now, this is the course map for the graduate certificate in exercise rehabilitation for sports injuries. I'm going to throw it over to the course coordinator, Dr. Jack Hickey, to talk you through the graduate certificate. As it's noted there, it is an entry pathway into the Master of Clinical Exercise Physiology. And I'll talk more about that at the very end. But for the meantime, I'll let Jack talk about how it's delivered.
Thanks, Christian. So, and thanks to everyone for joining us this evening. The first thing you might notice when looking at the course map for the grad cert of ex-rehab for sports injuries is that from 2023, this course is going to be delivered via ACU Online, which is a slightly new platform for ACU. Rather than being campus-based in your enrolment, you'll actually be enrolled in a campus called ACU Online if you go down this pathway of studying this particular grad cert. What that really means is it gives us a little bit more flexibility in terms of when you can study the different units in this particular course in a slightly more condensed period or potentially more spread out. And so to talk you through that, what this basically means is this program is fully online and it's taught completely asynchronously, which means content is pre-recorded. So pre-recorded lectures, additional content such as readings or podcasts and other interactive activities in each unit. And that is designed to give you increased flexibility with your learning around other commitments you might have, such as work, or be completing placements and things like that. So as you'll see, the study periods down the left-hand side of this table are listed as terms rather than semesters. That's because ACU Online it fits in with a term-based structure where each term is approximately 10 weeks in total duration, with a slightly more condensed study period of about 8 weeks. And that means that you actually only take 2 units per term, even if you're full-time. But a term or 2 terms is kind of the equivalent of a 6-month period in total. So what that means is if you enroll in the graduate certificate in ex-rehab for sports injuries full-time, you can take all 4 units across terms 1 and 2 and be completed by the middle of the year. Alternatively, you can enroll in this program part-time and enroll in 1 unit per term, and then complete those 4 units across the equivalent of a 1-year period as a part-time student. And you can also change from full-time to part-time throughout your enrolment, so there's a bit more flexibility there. I'll just talk very quickly to the units and what's included here. So you'll see in term 1, we have 2 foundational units. The first one being EXSC 515, which is exercise prescription for sports injury management across the lifespan, which covers content related to active individuals who may be suffering from injuries or pre-existing conditions, but at stages of the lifespan, perhaps that result in some unique pathologies. So this might be children and adolescents and certain musculoskeletal and sports injuries that occur in that population, or masters level athletes and managing pre-existing conditions in a more active population. EXSC 510 is the other unit delivered in term 1, and that's strength and conditioning for performance and rehabilitation. And that gives you some foundational knowledge in the application of strength and conditioning for the purpose of performance and also rehabilitation. And then in term 2, we have 2 units more specific to sporting injuries within, I guess, what you typically term your adult populations from sort of 18 to 40 years of age. And these 2 units both cover off on some common sports injuries such as hamstring injuries, ACL injuries, hip and groin pain, shoulder injury, ankle injury, and tendinopathies. And using a module-based approach, they both cover off on those injuries. However, in 651, we focus on sports injury prevention, so injury epidemiology and how to reduce the risk of those injuries. And in 669, we focus more on rehabilitation and returning an athlete to sport performance following those injuries. So they complement each other quite well. So as you can see, 651 and 669 are delivered in both term 2 and term 4, whereas 515 and 510 are offered in term 1 and term 3. So hopefully I haven't confused you too much there with the sort of different pathway to the semester approach, but I'm happy to answer any questions you might have at the end about that. I'll pass it back over to Christian to keep working through here.
Yeah, thanks very much, Jack. And there is, I guess, an added beauty as well to the way the course is designed. So for those who may go directly into the MCEP and then choose maybe one of their elective units to be one of these 4, there is an opportunity then to extend your study beyond the MCEP at a time when it suits you, to be able to do formal study, maybe to acquire or attain a graduate certificate in exercise rehabilitation for sports injuries, or potentially a graduate certificate in mental health, or a graduate certificate in high performance sport. So it's something that is quite unique, and our degrees do offer various exit pathways. Okay, let me continue on. Most people here probably want to know about the teaching team. We are both local and national in terms of our delivery, and therefore our clinical expertise does extend across borders. So let me start in Brisbane. Our team, you can see here, is very varied. We have a number of industry professionals that we think complement the existing academic team. Our course coordinator in Brisbane, if you look down bottom left here, is Dr. Daniel Vandenhoek. In semester 1 next year, you'll meet the likes of Dr. Cassia Beetham, Dr. Jemima Spathis. You'll probably meet Dan along the way. John Marnie has been teaching into our program as well. He's a psychologist teaching into lifestyle counselling, and he's likely to play some role there again next year as well. If I show you Sydney, this is our teaching team there. Our New South Wales course coordinator, as well as our acting national course coordinator, is Dr. Justine Steins, and I'm going to give you her contact details at the end of today's presentation. Other important people in Sydney within this team, some of you might have met Danielle Hazarati, who's currently our acting clinic discipline lead. So she's based in the exercise lifestyle clinics at our clinic in Strathfield. Michael Sarakis is our national professional practice lead, as well as our New South Wales practicum coordinator. So he'll be responsible for organising many of your placements for those of you who are based in Sydney. Similar to the other states, we have other industry professionals. In Sydney, we have Christine, who teaches our occupational rehabilitation unit there. In Melbourne, obviously Jack is joining me here. Others who you may know, if you're studying at ACU, is Liz Ormond, who's our Victorian course coordinator. We also have others with a lot of industry experience. So Jessica Hansen comes to us. She works part-time at ACU and part-time with Neuromoves, part of Spinal Cord Injury Australia. Ashley Bagarin is the lead exercise physiology at the Olivia Newton-John Cancer Centre and teaches exercise oncology at ACU. We also have Ben Lingard, who's the area manager for Work Focus, a big employer of graduates. He teaches our occupational rehabilitation unit. How does the course begin? So this image is a snapshot of our wet lab based at our Ballarat campus. It's a magnificent facility, and we've been running a one-day intensive wet lab learning day within both of our clinical assessment exercise for musculoskeletal conditions units. So first week of learning next year, we'll start with a day up in this lab. It's likely to be the week of the 13th, and we encourage, well, it's actually a fun road trip for all of our Melbourne students. In Sydney and Brisbane, we have local labs on campus, and our students will go there for their first day of learning. And when we ask graduates, what was one of the most memorable learning experiences through your degree, many of them will refer back to these days they spend in the wet lab. It is really a really exciting way to meet your peers. Here is an example timetable. This one is from our Melbourne course. You can see here that there is mixed mode teaching and learning. We have 2 days on campus with full day, pretty much a full day of online learning on a Tuesday with online tutorials, which very much focus on case-based learning. But you can see there that our on-campus days are a Wednesday and Thursday in semester 1. We created this timetable with our students, with our graduates. If I go back to when I first started at ACU in 2015, we were all evenings. It was 4 to 8 p.m, 4 nights a week. It was all on campus. That has evolved, obviously, as we've branched into a bit more online learning and thought really critically about, well, what do we want to be doing on campus? We want to be focusing on your clinical skills, professional skills, and that's why our timetable looks as it does. In terms of professional practice, 40 out of 120 credit points. So 4 units out of 12 are dedicated to professional practice. You can see here the difference between professional practice in undergrad exercise science and postgrad exercise physiology. A minimum of 140 in undergraduate studies, minimum of 360 in your postgraduate studies. The way that the practicum is designed at the moment, though it is slightly changing, is that you need to be developing your clinical competency with a range of pathologies. You can see there that they're flagged as cardiovascular, musculoskeletal, metabolic more broadly. Other AEP pathologies include mental health, kidney disease, cancers, and neurological conditions, just to name a few, but we know there's many others. I want to give you an example of what professional practice looks like within our degree. So this is a student who has completed the 4 clinical experience units. It starts with our pop-up clinic, as I mentioned before. That happens in semester 2, 636. So you'll be challenged and supported by some professional practice educators who we bring in from industry. You'll have your own caseload, and you'll be I guess, venturing into professional practice in a really supportive environment. And that's to ensure that when you then step out into your next experience, so for this student, that was with NeuroMoves at Spinal Cord Injury Australia, you're really ready to hit the ground running. You know what's expected of you as a student practitioner and a future allied health professional. And we think that you can then put your best foot forward to show off what you know and perform very competently on practice, on placement, sorry. In what we do try to do is ask you for your preferences for placement. So we invite you to tell us the types of pathologies that most interest you from your earlier studies in the degree, as well as where you might want to practice. So do you think you want to be in private practice? Maybe you want to test hospital, and we do try to place you at least one of your preferences. You can see here for this student, they've done placement in private practice, hospital settings, as well as in a community health organisation. And we think that makes our graduates very well-rounded, having worked with lots of different types of clients, as well as lots of or different supervisors who have different expertise. Here's just some of our external partners. We are adding new partners to this all the time. Many partners come to us. Very rarely do we go out seeking partners unless some students have asked us to. But more often than not, our partners are coming to us. They know that we produce a very high standard of student. Now, I promised that I was going to talk about entry requirements. As you can see here, there's probably two main points of distinction on this slide. If we just look at number one is for those students who have completed a bachelor degree accredited by Exercise and Sport Science Australia. So most of you who are coming to us from ACU will have done this. If you haven't, if you have studied an undergraduate degree, maybe it was in exercise science, but it wasn't accredited by ESSA, well, we still have a pathway for you to enter, but it will require you to show that you've met the requirements of an ESSA graduate assessment. So that's available online through the ESSA website. If that's you, reach out to us, let us know, and we can point you in the right direction. We've helped a number of students who came to us from degrees that weren't accredited, and then those students had to seek this entry pathway. Now, if you don't have the minimum GPA to enter directly into our program, so the GPA is 4.6, there is a couple of options for you. One option is to go out and gain substantial relevant industry experience. So that typically means full-time work in the field or in relative fields where you are demonstrating the professional standards of exercise science, potentially exercise physiology. And as it says there, at least 1 year post-bachelor. And the other option is for you to enter into our graduate certificate in exercise rehab for sports injuries. So that has you studying at a postgraduate level and demonstrating that you can do so to a GPA of 4.6 or above. So potentially that means you could be entering mid-year next year if that's you, or coming back to start the year after. Not only will you need to have done those to be eligible for our entry into our degree, but you must add or submit a curriculum vitae outlining your relevant industry experience, as well as submit professional referees information. So sometimes we will call your referees to verify your industry experience, but we think that's only a good thing. Okay, last but not least, applying for the MCEP. So the application closing date is the 31st of December this year, and that's for those who are seeking entry to commence semester 1, 2023. We've already commenced reviewing applications. Some students will have already been provided with maybe a conditional offer, potentially even a full offer to study at the MCEP. Things to help you with your entry applications, obviously have your curriculum or your CV drafted and ready for submission. Be sure to respond to ACU admissions requests when notified. So they might flag that you're missing something. Be sure to respond right away. As I said, the conditional offers may be offered ahead of course completion if you have completed or are completing an accredited undergraduate degree. So there's probably a few people here joining us from ACU who've already or will be receiving a conditional offer shortly. So you may have received a letter from your national course coordinator. And for graduates coming to us from a non-ESSA accredited undergraduate degree, as I said before, we do offer individual advice regarding the ESSA graduate entry assessment. On this slide are our contact details for local course coordinators, as well as Jack Hickey's contact email and my email. So be sure to reach out to us, touch base, let us know you're interested. If you are considering applying to the MCEP to start next year, yeah, we always like to start those conversations early. So thank you very much for joining us. We're open now for Q&A. Yeah, hopefully you've got plenty of questions that we can answer so everyone's informed. Okay, our first question is, could you explain the conditions of the conditional offer that some of us have received? So Jessica, I believe, now Jessica, you may be coming to us from ACU. If that's the case, the conditional offer means that there's conditions that you need to satisfy for that to convert to a full offer. Typically, that means that you need to complete your degree. Now, what we have done, or the National Course Coordinator for Exercise Science has done an initial screen to determine students who at the moment have a GPA above 4.6. You might be in your final semester of study. So for you, you need to maintain that GPA during your studies and complete your degree. Once complete, admissions know to then convert your conditional offer into a full offer, which you can accept for commencing the degree next year. I hope that answers your question. David has asked, if we were offered a conditional place, do we still need to apply via the ACU website? No, you don't. You don't need to. You will be automatically notified by the admissions team. Yep. So you will receive an email with a conditional offer or informing you of your conditional offer to the MCEP. And the only thing that you need to do is meet the conditions of that offer. As I say, typically that's just completing your degree and maintaining your GPA over 4.6, and you will receive a full offer to study the MCEP. And Caitlin has asked, do you still need to put in an application if you get an offer already? No, if you have a conditional offer already, you do not need to apply. That means you're already in the pool of all students who have applied. We take out that middle step of you having to apply because you're already one of our students. We have an anonymous attendee. I finished mid-year and got a conditional offer, but haven't been sent a full offer yet. That's a really good question. You might want to double check that you've satisfied all the conditions of the offer, and then you could actually send admissions in the email. Alternatively, you can contact one of our local course coordinators and they'll be able to help you with that to determine exactly why that hasn't converted to a full offer. I hope that helps.
Christian, there's a couple of questions in the chat as well about, is the conditional offer for masters only for next year or can you defer? I'm not sure if you can see those questions.
Yes, I see. Yep, can re-enroll mid next year. Yes. Let me start with the first one. Yes, so that is a conditional offer to commence semester 1, 2023. If you are choosing to, or you would prefer to commence your study in semester 2, you are open to do that. Do know, however, that the course map does change a little bit for you. So get in touch with us and we can provide some more information about the course enrolment guides. It does slightly extend your study if you choose to commence in mid-year. The reason for that is because one of our units, our responsible clinical practice unit, has prerequisites, which mean you have to complete all of the semester 1 units of study. So the shortest the degree will be if you commence mid-year is 2 years. The other thing there is, can we defer? Yes, you can defer your offer, though know that there is a difference. We have Commonwealth supported offers and we have full fee paying offers. We have a limited number of Commonwealth supported offers, which means that if you are offered a Commonwealth supported place, you cannot defer the Commonwealth supported place. You can still defer your place, but you will be re-ranked with the next round of applicants to determine whether or not you receive a Commonwealth supported place in a future commencement period. I hope that answers that question. I see that Ethan said, I got my degree today with a GPA above 4.6 with a conditional offer. What else do I need to do or know about the conditional offers? Can we defer once we accept? As I said before, yes, you can defer. In terms of admissions processing those conditional offers, that will happen over the next 4 to 6 weeks. So probably wait until early to mid-November. They'll convert any conditional offers to full offers for eligible students. So best that you wait to hear from admissions. Mitchell has asked, do you need to apply for a CSP? No, you don't apply for a CSP. It's based on a ranking. So it's based on ranking GPAs, and we continually re-rank, or we re-rank every month. So everyone that comes in or applies to our degree will be ranked, and then depending on how many CSPs we are offered, the university across all disciplines and across all degrees has a limited number. We are told by the university how many we receive nationally, and then we allocate based on the ranking. So that will typically take place over the next few months. Students with very, very high GPAs may be offered CSPs at the point of application. But as I say, we do a lot of re-ranking. A lot of people apply to multiple institutions. So you might apply at ACU, you might also apply at University of Sydney or Deakin University if you're in Melbourne. But what we do is we are always re-ranking depending on people who have accepted or not accepted. So that pool does change from time to time. Yeah, thanks very much for that, Sarah.
There's a question about, do students need to gain a year's industry experience before starting if they've got a conditional offer?
That's a really good question by Jacob. Typically not. No, if you've received a conditional offer, the admissions team is satisfied that you've met all of the requirements for entry. So in other words, you have the GPA to get in, and that they are just seeking maybe your course completion. That might be the case with you, Jacob. Yeah, but typically they'll refer any applications that are coming in via that industry experience criteria will be referred to course coordinators for review to validate the industry experience. Ethan has put, if our GPA is slightly below the GPA required for pathway B, is there a pathway like there is option A to work towards? Ethan, I think I interpret your question correctly. So if you're seeking to make the transition to our thesis pathway to conduct research, is there some alternative pathway if you're below the 5.5 GPA requirement? Unfortunately, there's not. And that is just because of the strict criteria that are applied with other research degrees. So our degree is consistent with those to ensure that we maintain the same standards. Now, there are options if you were to be working maybe as a research assistant and developing research skills and doing research training outside of maybe formal study. That might be a pathway to be able to work with supervisors to notify the admissions that, well, actually, I have research training skills. Potentially, you're an author on a publication, so you can show a research track record, and that will be looked at and assessed separately. So that would be your potential pathway into research, into a research degree. Jessica's put, what is the latest point in which we need to accept and offer? In my case, I'm playing. Yep, very good, Jessica, and I do encourage you to do that. In terms of accepting offers, it can really be right up until the end of January, though if you are offered a CSP, know that you will be given an ultimatum probably earlier than that, because we don't want to hold back other students from the potential for a CSP if you are waiting for other institutions. So we're very keen to confirm our student numbers early, because our degree commences in mid-Feb. So know that we will encourage everyone to be accepting CSPs by early January at the latest. Okay, I wonder, does anyone have any other questions? Maybe it might be questions that you have regarding placement, regarding our teaching team, regarding our, I was just trying to think, maybe our timetables. Okay, is there a sample timetable for Sydney? Daniel, really good question. You could probably talk to our course coordinator from Sydney to show you an example of the timetable from this semester or semester one this year. We anticipate that it's going to look very, very similar next year, but it will determine somewhat on the enrolment numbers as to just how many practical classes we do run. But it does look comparable in terms of having 2 on-campus days. Okay, got a couple of extra questions here. Hero has asked for conditional offers to clarify, we do not have to submit anything. That is correct. So you do not need to submit an academic transcript, because if you've been given a conditional offer, it means we already have that information and we are just waiting on you to course complete. In terms of referees, if you're one of our students, then you won't be asked to submit a CV with referee information, no.
There are a few questions on placements about specialising, whether it be in kidney disease, cancer, mental health. A few questions about those. Are they able to be specific? Yeah.
Yeah, if we want to specialise in a specific area such as kidney disease or cancer, is there specific classes? It's a very good question. Now, when it comes to learning about kidney disease as well as oncology, they fall within our chronic and complex conditions unit. So every student will learn about kidney disease, as well as the different cancers. In terms of placements, yes, you can certainly tell us, or we invite you to tell us your preferences for placement. So if you want to be doing placement in oncology, we ask you to let us know, and we do that formally through our degree. And then we do try to place you with some of our providers who work with clients with cancer. In Melbourne, I can talk to our number of our placement providers. We work with the likes of Moving Beyond Cancer. We place students at the Olivia Newton-John Cancer Centre, as well as the Australian Prostate Centre as well, plus a number of the hospital sites and community health organisations will work with clients with cancer. So I hope that answers that question. Louise has asked, are the timetables set so there's only one class for each unit, or are there option times? I don't really know what you mean by option times there, Louise. But for most of our units, there are 2 classes. I think the only unit that doesn't have 2 classes is lifestyle and exercise counselling. But the other units will have a practical class, so a 2-hour practical class on campus each week, as well as an online tutorial. Now that, as I said, the online tutorial is typically case-based. There will also be some asynchronous learning materials that you're asked to complete before coming to your tutorial. So let's just give you an example of 635, clinical assessment and exercise for cardiopulmonary conditions in semester 1. It might be about chronic heart disease. and you might be asked to complete a lecture, a reading. There might be a quiz that you do. You then come to class. They'll be presented with a client who presents with maybe one or a couple of relative pathologies, and then you'll brainstorm with your peers about maybe things like the types of assessments you want to be conducting with that client, the types of subjective questioning you need to do to ensure that your further testing or exercise prescription is going to be safe and effective. And then you might start to look at the evidence supporting the types of exercise prescription that will be both safe and effective for that client. And then you get to come to your practical class and probably do something like an ECG, or you might be actually conducting a HIT program, an evidence-based HIT program, or a couple of different ones. You might be looking at what are the different challenges you might have working with that client in practice. So that gives you an idea of how you will learn that material. Daniel Chow's asked, what is the next step after Pathway B? That's a really good question. So to give you an idea of what our current students are thinking, we have 3 students in Pathway B at the moment. They are all leaning towards high degree research and the desire to go on to do a Doctor of Philosophy. Pathway B is effectively combining coursework and honours into one 2-year degree. And yeah, they're looking at going down that pathway next year, provided they get the grades to do so. David has asked, I received a conditional offer but won't complete my undergrad until mid-year next year. Will my offer still be valid until then? David, it might not be, but we do this rescreening every year, and we provide admissions with those students who will be completing in each subsequent study period. So if you become eligible for a conditional offer to commence in semester 2 next year, then you'll be notified of that. Similarly, if you're intending maybe to push back to semester 1 the following year, you can defer till then. So there's no differences there. Hero has asked, will CSP positions be offered for semester 2 enrolments? We do have some Commonwealth supported places for those students commencing semester 2, but typically we have less students commence semester 2 compared to semester 1. So we are typically offered less Commonwealth supported places for semester 2, just so you know.
There's a couple of questions about people not completing. So one person is not finishing placement until next year, but has received a conditional offer. That's from Jess. And another, yeah, if you can just address those. Yeah,
so similar to what I think I said to David there, if you find that you're actually not course completing, then you won't obviously be offered a full offer to study in semester 1 next year, but your conditional offer won't go away. So in other words, it will just move to the next study period. So if that is you, then that's, as I say, your conditional offer will convert to a full offer for the next upcoming study period, provided that you meet all of those conditions. And then it's your decision whether or not you choose to study in that upcoming study period or the subsequent one. So it might be that you've been offered to a position for semester 2 next year, but you decide you want to defer to semester 1 the following year, which is perfectly okay.
And then there's a question from Ethan about whether or not as an AEP you're qualified to do hands-on testing. I don't know if you addressed that. I think you did. Yeah.
I might jump in on that one, if that's all right. I just saw that one's here. I was going to type a response. I may as well talk instead. It's a great question, Ethan. So it's probably relevant to myself because I teach the musculoskeletal units in the EP Masters as well, at least here in Melbourne, and coordinate one of those units nationally as well. We do teach some hands-on testing with respect to tests that require you to maybe assess a client or a patient's joint range of motion or their strength, and that will absolutely require you to be hands-on with a client. However, the purpose of you doing that test is not going to be diagnostic, because diagnosis is outside of an EP's scope of practice. But it's clear, and Exercise and Sport Science Australia makes it abundantly clear as well, that you're absolutely allowed to learn how to perform tests and use tests in your own clinical practice that other practitioners might use for diagnostic purposes, provided that the purpose you're using it for is to inform your subsequent intervention. So the best example I can give is, you use the example of someone with shoulder impingement. So you have someone with shoulder pain. As an exercise physiologist, I might assess their shoulder range of motion in a few different planes of movement, and I might also assess their shoulder strength. Now, some clinicians might use that for diagnostic purposes, such as a physiotherapist who has scope of practice to diagnose. But as an EP, what I use that information for is actually to tell me that client has a specific weakness in these muscle groups, or they have lack of range of motion in these specific movements, and that informs the exercises that I'm going to prescribe for that particular patient. So that's probably how you can differentiate between diagnosis and using those tests for another purpose. So I hope that answers your question, Ethan.
Yeah, and I think that extends to many of our other units as well. So it might be that you have a client who has secondary symptoms associated with their primary pathology that require you to do maybe a symptom-limited cardiopulmonary exercise test. We will do that with most of our clientele to ensure that when we prescribe cardiopulmonary exercise training, we're going to do so safely and effectively. So I think that's answering his question.
And there's one question, and I'm not sure if you answered this, sorry, when should we expect full offers if we're already graduated?
Yeah, that's a good question. I think most of after talking to admissions recently, they are reviewing and will be converting conditional offers to full offers over the next period. So that could be happening anytime from next week right through to late October through November. And really, we're updating and reviewing offers all the way through until the commencement of semester 1 next year. So if for whatever reason there might be a delay in your course completing and you do have a conditional offer there that hasn't yet converted to a full offer, know that we haven't forgotten about you. We will follow up with you. I know that sometimes I'll reach out to those students just to advise that everything's okay, and we can go all the way up to the last minute, right up to when semester 1 starts. Okay, we're getting close to 6 o'clock. We might have time for maybe 1 or 2 more questions if there are any. Okay, I don't think there's any additional questions coming through. Are there, Sarah?
There's one, I think, asking the difference between a master's in exercise phys versus physiotherapy in regards to providing prescription to a client, or a better question. Sorry, this is in the chat from Ethan.
Oh, okay. Probably just following up a little bit from your previous question, Ethan. So it's a common question. What's the difference between an EP and a physio? One of the primary differences is physiotherapists are diagnostic or have scope to diagnose, EPs don't. However, EPs will typically have more training in exercise prescription. So that's probably the biggest difference. Yes, both physio and exercise physiology will teach some exercise prescription. However, it's much more in-depth in an exercise physiology degree than it would be in a physiotherapy degree. Whereas the diagnosis and the pathology sort of knowledge that you would learn in a physiotherapy degree would be more expansive because that's within their scope of practice. So that's probably the most, simplistic difference between the two.
Yeah, I recommend probably to go to similar information sessions to this one. Also to look more closely at course maps, and most universities, including ACU, will publish unit descriptions online. Every one of our units has exercise within it. Whereas if you look at maybe a master's program in physiotherapy, that'll be limited to 1 or a couple of units across the whole degree. Okay. I can't see any more questions come in. Well, if that's the case, or know that if you do have additional questions, feel free to reach out to the contacts listed here on the slide. You can talk to your local course coordinators, or you can come to myself or Jack. Thanks very much for joining us. We understand that probably competing for your time with many other things that you could be doing this evening. So thank you very much. And yeah, we welcome you to ACU hopefully in the new year.